The next speaker definitely probably does not even need an introduction. Our next speaker is Dr. Priti, who has already, involved herself in the stage in the morning as well, and has always played an important part for all of us. She's one of the organizing committees, the president of the IAF Society, who has been a pivotal role in bringing functional medicine to all of us over here. Thank you so much for your valuable time, Dr. Preeti. How are you doing today afternoon?
I am good, and good afternoon, Amarjeet. Thank you for all what you are doing. I think you are actually keeping the energies high, and therefore online conference is as good as an offline conference. Thank you.
Thank you very much, Dr. Preeti, and allow me to kindly introduce you as well. So, Dr. Preeti, definitely also known as the gut goddess, is a renowned functional medicine practitioner and an advocate for holistic health. With over 2 decades in medicine and a personal journey of reversing her own diabetes, Dr. Preeti has transformed countless lives through her innovative approach. She is the CEO of MediSchool and the president of the Indian Association for Functional Medicine. Today, she will be delving into a wonderful preventive topic, cancer and the ketogenic diet. She'll be shedding light on how dietary changes can play a pivotal role in cancer care. Dr. Preeti, the stage is all yours. Let's learn about ketogenic diet and how it can help us prevent cancer.
Thank you, Amarjeet. And somebody will have to share the slides.
Give me a moment.
Perfect. Until then, in the chat box, please. Anybody who is using keto in their practice today? Yeah. So, why did I take this topic, ketogenic diet? Because in cancer management, like I remember Dr. Sibal saying yesterday, that I tell my patients, try whatever you can, you don't know what will work for you. That is where the role of ketogenic diet comes into picture. Ketogenic diet can really revolutionize cancer management if done properly, if done in a healthy way, through a functional medicine lens. It can actually help cancer patients recover faster, have better quality of life, and lesser symptoms of the therapies which are generally used today to treat cancer. So, how would you feel if I tell you that, what if we could leverage nutrition to complement cancer treatment by targeting cancer's greatest vulnerability? Anybody who can tell me what's the cancer's greatest vulnerability, which we can target through nutrition? The answer is already on the slide, though. It's metabolism, right? So, what I strongly feel is we can outsmart cancer, not with a pill, but by rethinking what's on the plate. Isn't this powerful, friends? It is. And as functional medicine practitioners, we all know our superpower lies in connecting the dots. So let's see how ketogenic diet could be the missing fight in our fight against cancer. Yeah. You all know in functional medicine, we don't just treat. Yeah. We transform. So cancer doesn't define our patients. Let's see what tools we can use and convert them into an opportunity for metabolic resilience and holistic healing. And one of that is ketogenic diet. So all those who are not using ketogenic diet, or all those who know about ketogenic diet but have never used it because of all the myths and facts which are in our society or community, Renuka, I would request you to share that myths and facts sheet with everybody after the talk. Please go through that sheet.
Sure, it will be done.
Yeah, thank you, Amarjeet. So, what is keto diet? Keto basically is high fat diet. How does the name come? Because fat, when is metabolized, it produces ketones. And from ketones comes keto, right? So 70 to 80% of fat, 5 to 10% of carbs, and 25 to 30% of protein is what is the sum total of keto diet. So what I was telling you here was generally what I see, a lot of people doing a different way. I won't say incorrect, but they have this myth that high protein is keto or high protein is fat. First thing I want all of you to take back is high protein is not keto. We all know our body can convert protein into glucose, right? And therefore, it will derange you from ketosis. And therefore, keto is 70 to 80% fat. Yeah. And we will see how we can do it in a healthy way in the coming slides. So, as I said, state where body uses ketones for energy instead of glucose is what is ketogenic diet. And how it is useful in cancer is basically we all know that cancer cells, they thrive on glucose, and when they don't get glucose, they are not able to use ketones for their energy, and therefore we can kill cancer cells. Yes, I will talk about situations where this will not work or we will not be able to achieve ketosis. Yeah, but for now, so let's look at the history. Next slide, Amarjeet. Let's look at the history of keto diet. In 5th century, or even before that, in BC, Hippocrates used fasting in severe patients. And they realized that the results were very, very good. They used to do it twice a month, thrice a month, then once a month, and they used to see a decrease in the number and intensity of seizures there. 1921, classical keto diet was created for epilepsy. And then it moved on. 1971, Huttenlocher used MCT-KD created. 1990, Rosenthal improved it further. And as you see in this chart, progress has been happening, and 2021 has been the 100th anniversary of keto diet. Now, what does this tell us? At least one message the slide gives all of us is there is nothing to be worried about keto diet, right? So keto, if done right, is a phenomenal diet, and for cancer patients it can be a game changer complementary therapy. Next slide.
Yes, ma'am.
So when we look through the functional medicine lens for cancer and metabolism, Warburg effect. This is what actually first made people think that yes, keto diet can be useful in cancer. In just simple steps, what is Warburg effect? It says that cancer cells rely majorly on glucose-based metabolism even when on aerobic glycolysis. Ketones are an ineffective energy cells for most tumor cells. And what does ketosis does in cancer management? First, it restricts energy for cancer growth. Therefore, it reduces insulin and IGF-1, therefore decreasing tumor promoting factors. It has anti-inflammatory effects. Ketones like beta hydroxybutyrate, they actually help decrease systemic inflammation. It enhances oxidative damage to cancer cells, which is huge. And it improves mitochondrial function, hence supporting healthy cells and stressing out cancer cells. So I have tried to make it as simple as I could so that we know that these are the things which keto diet is touching upon. So if you look at this picture or diagram, you will see that in a normal cell, oxidative phosphorylation and anaerobic glycolysis helps produce ATP. Whereas in cancer cells, what happens is excess of lactate is produced, which causes biomass incorporation and hence cell proliferation, leading to cancer in our cells. If we look at a little more detail on how ketogenic diet acts in cancer cells, of course, like I said briefly in the previous slide, starving cancer cells. So glucose availability decreases, energy supply to the tumor cells decreases. And what will happen if they don't get energy? The cells will start dying, right? Insulin, we all know insulin resistance, one of the very, very important factors for cancerous growth in our body. In fact, there are data which says that almost in all cancers, if you will go back, 99% of cases, you will find insulin resistance in those cases. Even if they are thin, they are fat, does not make any difference. But insulin and IGF-1 are very critical growth factors for cancer cells. Anti-inflammatory, of course, low carb will reduce systemic inflammation, which is a driver of tumor growth. Also, ketones, which I've already mentioned, BHB is very, very important as an anti-inflammatory in cancer patients. Ketogenic diet will increase oxidative stress in cancer cells and therefore will cause cell death of those cancer cells. Imagine I think all of us here believe in functional medicine, and we all know that food is medicine. And we have a lot of science to prove that food is medicine. And of course, it will also inhibit the formation of new blood vessels that supply tumors, which is angiogenesis. Therefore, as in partnership with conventional therapies, it can really help cells, stabilize, normal cells grow, and cancer cells become less. If you look at this energy production here, you will see that when you do KD for normal cells, lower levels of glucose, it prevents glycolysis pathways. And therefore, it increases ketones as a result of fatty oxidation. And thus, it enhances acetyl-CoA in mitochondria and compensates for the ATP which was not being made at the stage of glycolysis, right? So a normal cell, through this process, ATP or energy is made. Whereas if you look at cancer cells, when keto diet is given, no glycolysis happens. Secondly, mitochondria are dysfunctional and therefore cell cannot produce ATP. And hence, ketogenic diet prevents cancer cell proliferation, right? So, as I always say, functional medicine is scientific, evidence-based, naya avatar of conventional medicine. All what we study in conventional medicine is what we study in functional medicine. And hence you see all these cycles which we as doctors have grown up, since we entered medical college, looking at them again and again. They are clearly suggesting why what is working even in terms of diet. Of course, less evidence is there. And I think to create evidence and to do a lot of trials, we need a lot of money. And if people can't make money out of something which they can't make out of a ketogenic diet, the interest in doing studies around these things is slightly lesser, right? But still, we have enough data to show that it as an adjunctive therapy, it works well for glioblastoma, breast cancer, even colon cancer, prostate cancer. We have studies to show that we must consider this as a complementary therapy, not as a standalone therapy. Now, what is important and why a lot of people are not using it, despite the fact that we have all data, we have science, we know which cycle is being affected, people are not working. So first, let's see how we can integrate as functional medicine practitioners. One, we need to customize ketogenic protocols. We need to balance macronutrients to ensure adequate nutrition. Now, please wait. I know you are thinking, how do we do this? Keto is keto, 70-80% fat, 25%, 20% protein, and 5 to 10% carbs. Just have a little patience. I will come to that. Few lab tests which we should monitor: blood ketones, especially beta HBG, glucose ketone index, GKI, you can do it in your clinic. inflammatory markers like HSCRP, IL-6, lipid profile, and mitochondrial markers. Combine these with fasting mimicking diets, with intermittent fasting, with hyperbaric oxygen therapy, with mitochondrial support like CoQ10, alpha lipoic, D-ribose, L-carnitine, and see the miracles happening with your patients. So before I move forward, I want all of you to do a little exercise. So if you have a pen and paper with you, think of your own daily food intake. So whatever you ate yesterday, just write it down. Or maybe any patient you think you are working with and you feel till now that, Monday morning, if I put that patient on keto, I can help that patient. Write their typical daily meal. Now, from that daily meal, remove all the things you have on the left side or remove 50% of carbs and replace it with fat. For example, replace rice with cauliflower rice, replace bread with lettuce wraps, replace chapati with almond flour chapati, and don't change anything else. And that is where you start Monday morning. Now, once the body adjusts to this, then try and see if your protein and carbs in your legumes and vegetables also can be brought into balance. Please remember, keto with lots of vegetables is the right way to do keto. Of course, we need to use low glycemic index vegetables with it. So what is ketosis or what is ketogenic diet? To me, ketogenic diet simply is coming back into the space where you know that your body is a hybrid car. Cancer runs only on glucose, petrol, but a ketogenic diet turns on your electric motor, which is ketones, leaving cancer stranded. Right? So hybrid cars are in thing now. And if anybody of you is thinking of shifting to hybrid car or buying it or have already bought it, and if you are not doing keto, I think time to start it is Monday morning with the right patients. So these are some studies. I have been told that I have to finish my presentation in 20 minutes. So, but Frontiers in Nutrition, Cancer Metabolism Journal, Current Issues in Molecular Biology, all of these have published studies where they've shown efficacy of keto diet. Metabolic adaptation, it should definitely be used as a complementary therapy, and anti-inflammatory and anti-angiogenesis effects actually increases the scope of benefit you can get from keto diet. Now, very, very important, and this is what I really want all of you to focus on. Which conditions or which patients you will have difficulty helping them achieve ketosis? So a lot of times I get patients where they've been to a doctor and another, they've tried to get into ketosis, but they've failed. So when I was making this presentation, I started writing down which cases were those. And this is what I could sum up with. I realized that people with high insulin levels or insulin resistance, very difficult to get them into ketosis. This is also published in Journal of Clinical Endocrinology and Metabolism. So why I'm giving references is because I really want all of you to know that this is not alternate science. This is medical science. All hospitals have their nutritionists trained on keto diet, and this is being used since 1921. It is not yesterday that we started using it. Genetic variations in patients where we have ApoE, CPTA1A, FASN, they will hinder efficient fat oxidation and therefore ketones mushkil banenge. Nutrients Journal has a study published on that. कार्बोहाइड्रेट या प्रोटीन इनटेक ज्यादा है या मेटाबोलाइज नहीं हो रहा है. Clinical Nutrition Journal has published this, but these patients also you will find it very difficult to get them into ketosis. And then Diabetes Care says that certain drugs, especially patients on corticosteroids, antipsychotic and sulfonylyl ureas, ketosis में लाना time लगेगा. You will have to really work lot more intensely than what you will have to otherwise. Can anybody relate to this and think of any patient जिसमें oh maybe this is the reason that patient was not getting into ketosis? If yes, please give me a thumbs up in the chat box. Then come some metabolic conditions where metabolic inflexibility is there, hypothyroidism is there, transition from carb metabolism to fat metabolism is difficult. Alcohol consumption, difficult to get into ketosis. Conditions like infections, trauma, severe stress, which means you have high cortisol or low cortisol. This will promote glucose production and prevent ketone generation. Right? So it's not very simple. We will have to first rectify these conditions and then try and get the patient in ketosis, especially infections. So very recently, I had a patient, cancer patient, who came to me. She was working with a very renowned doctor. And the challenge was that the doctor was trying to get the patient in ketosis because for his treatment to be successful, ketosis was important. But despite working for 3 months with diet on the patient, this was not happening. Now, when the patient came to me, I checked for infections. She had H. pylori, she had hypothyroidism, and she had insulin resistance. We corrected all those three. In a matter of 1 month, we could get her into ketosis. And the therapy started working and she started getting better results, started feeling energetic. And the doctors were surprised and said, whatever you're doing, continue doing that. Things are working right. Right? And of course, if you don't give enough fat, you will not be able to reach ketosis. But here is another catch, which at times we forget, which is, will any fat do? No. Quality of the food is extremely important. But before I come to quality of food, another very important thing which can be a game changer for all of you, and I think a lot of speakers since morning have been talking about it. Mahesh spoke about it, Dr. Lenny, Dr. Vivek. It is sun exposure. You know, emerging research is suggesting that exposure to sunlight, particularly UVA and UVB, which is there in the morning, it plays a role in enhancing ketosis, right? So UVB radiation, which is between 11 to 1, it helps synthesize vitamin D in the skin, which improves insulin sensitivity, glucose metabolism, and hence promotes ketosis. Of course, there's a study published in Endocrine Reviews which indicates that vitamin D is crucial for metabolic stability. And vitamin D, which we get from sun, is very, very, very crucial. We can't undo that, right? Also, UVA exposure increases nitric oxide, enhances blood flow, and most importantly, mitochondrial activity. And we know healthy mitochondria is important for essential fat oxidation and hence ketone production. Yes or no? Yes. So a study in Cell Reports was published which showed that yes, sunlight improves mitochondrial efficiency, especially in adipose tissue. Then comes regulation of circadian rhythm. Sunlight in the evening, very, very important. Cortisol and melatonin are balanced. Review in Nature Metabolism emphasized that circadian alignment and metabolic health are connected. Yeah? And then, of course, sunlight exposure also helps in potential appetite suppression, so your cravings go away. Proceedings of National Academy of Science published this, that yes, right time, right type of sunlight exposure can help you achieve ketosis faster. Right? And now I want to talk about high quality of foods. Right? Because this is extremely important. I have seen patients coming in my practice saying they are doing everything, and yes, they are doing everything. But the moment we change the quality of food, the results change. How many of you have seen that? I think all functional medicine people have experienced that, right? Yes. So, first of all, prioritize high quality fats. MCT oil, coconut oil, rich in MCT and lauric acid, supports ketone production. Grass fed butter or ghee, avocados, olive oil, fatty fish, right? And people have studied it. It has been published in nutrient journals, Journal of Lipid Research, that high quality fats can help you get into ketosis faster. Very important, reading food labels. Now, I think I started doing cyclic keto in my practice 9 years back, right? And I think I wrote a book about 6 years back on cyclic keto. Now, that's the time a lot of companies were coming in the market to give you food. And I saw that most of those, food subscriptions did not help my patients get into ketosis. We had to stop that. Also, a lot of keto foods in the market. Please read the label. All your effort can go for a toss in one packet if you don't read the label. Processed foods, or the packaged foods, they often contain sugar or starch additives. Sausages, all dressings, they can have added sugars, and we need to look into that. Another very important thing for you to do effective ketosis, especially in your cancer patients, include bone broth, sodium. So in ketosis, sodium, potassium, and magnesium can get into imbalance. If you use bone broth, you can balance sodium. Add spinach and avocados for potassium. Add nuts and seeds for magnesium. Journal of Academy of Nutrition and Dietetics has published this, that if you add this, chances that your patient will be able to do ketosis for a longer time, will get more benefits by getting into ketosis, and will reach ketosis faster are much higher. Of course, Cell Metabolism Journal clearly states that fasting accelerates glycogen depletion and hence ketone production. All of us know that our body first uses glucose as energy. Once glucose is exhausted, body uses glycogen, which it has stored in liver when we have eaten extra glucose, right? Now, once that glycogen stores are over, that is when body starts using ketones. And that's the reason intermittent fasting plays a huge role in making your keto diet effective in cancer patients. Of course, ketogenic superfoods are eggs. I generally recommend Kadaknath ke ande or any grass-fed stuff. Dark leafy greens. They are low in carbs, very nutrient dense, and gives you a lot of nutrition. Berries, but in moderation, and fermented foods. We have been talking about probiotics in our sessions today. So fermented foods play a huge role. I generally use sauerkraut and kimchi when I'm doing ketosis with my patients, because a lot of other probiotics, they use sugar or jaggery, and which we have to get good bacteria. But then in these patients, sauerkraut and kimchi are my go-to. Optimize protein intake, and also do it through grass-fed meat, pastured eggs, and wild-caught fish. Diabetes, Obesity, and Metabolic Journal talks about this in detail. Hydration is very, very important when you do keto diets. What happens is a lot of electrolytes are lost, and therefore you can use salted water throughout the day. I use Celtic salt. You can use Himalayan pink salt. That will help prevent dehydration, which balance minerals. It will help you either not get keto flu or get out of keto flu much, much, much faster. Anybody here who is here done keto diet and had to quit it because experienced keto flu? So one simple tip which we can do is that, we can just keep ourselves well hydrated. And of course, we can use exogenous ketones if required. So I've had a lot of patients where I've used keto diet as complementary diet for my cancer patients. But this was very cute, which actually made me think that's why I do what I do. This was a young mother battling with glioblastoma, put her on ketogenic diet with her other therapy, and tumor progression slowed down, but she energized herself and was active for many years with her kids. And yes, as I said, this really made me think, wow, I love what I do. Of course, there are a lot of controversies. I've shared a myths and facts sheet with all of you. There are some limitations. And so, one of the limitations, one of course, is in patients where there is a lot of gut dysbiosis. Please, please, please do not use keto diet. It will not help. Second, if your patients have low triglycerides, first let your patient eat and get some energy in their body. Let their body create some energy, even if it is with glucose. Once that has happened, then put them on ketosis. You know what we say, that अगर हमारे पास कुछ नहीं होगा तो हम किसी को क्या देंगे? So if the body is not able to make energy with any source, and we start insisting that no, 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 you have to make energy only with fats, then it will not help, right? And also, don't think of it as a stand-alone treatment. Complement it with conventional therapies or other functional medicine therapies, which we've been talking about, and you will see lot better results. So these are few studies where ketogenic diet was used. Studies are published in Nature Reviews Cancer, Journal of Ophthalmology, and So why I'm saying all this is that it is scientific, it is evidence based. You must try it if you've not done it till date. So for me, ketogenic therapy is not just about nutrition. No, it's about transformation. And I want you to leave with one question. Will you be the catalyst for this change? Thank you very much for your patient hearing. I tried to cover all what I see that people miss. And
Definitely, Dr. Preeti, a session that was so engaging. I didn't want to intervene even after the timer went up. You can see a lot of claps, you can see a lot of thoughts coming in for you. Undoubtedly, a lot of actionable things that were shared by Dr. Preeti. I'm pretty sure everyone loved it. No one even complained. So thank you so much for all of that. I'm pretty sure there were so many things that people could take away from. However, I will not be taking up the questions. And yes, I'm pretty much motivated to go for a hybrid car now. So,
you must, right? Great. And I
so
will answer the questions in the chat box.
yeah, yes, yes,
Thank you
please.
very much.
Thank you so much for the cooperation, and thank you so much for having you. Undoubtedly, a very infectious energy there. Thank you so much, ma'am.
Thank you. Bye bye.
Bye.